Hello, I'm Dr. Lou Bucky, and you're watching the Plastic Surgery Channel.
Hi, I'm Deanne Moore, and welcome to the Plastic Surgery News. Thank you for joining us today. In this week's report, we'll tell you about some new high-tech advances in surgical procedures coming out of Tokyo. We'll also fill you in on the booming trend of plastic surgery in the Middle East, and give you an update on what a panel of plastic surgeons has to say about fat grafting in light of an extensive review. All of that coming up, but first, a group called the Physicians Coalition for Injectable Safety wants consumers to know that two methods of a cosmetic injection, mesotherapy and carboxytherapy, can be hazardous and should be considered with caution. These two methods aren't widely known, and as cosmetic procedures, they haven't yet met the approval of the Food and Drug Administration. Now, mesotherapy, which is another term for injection lipolysis, involves mixing vitamins, drugs, and enzymes into a compound that is later injected into the body as a way of dissolving fat cells or rejuvenating aging skin. Now, the practice itself isn't new. It has been used since 1952 and is available in many countries. But Mark Jewell, the leader of the Physicians Coalition, recently said that mesotherapy as a cosmetic method is something that has yet to be tested and studied enough to meet respectable American medical standards of safety. Patients who are considering it, he said, should be advised that the injections include products that may be unsafe. Carboxytherapy, the other method in doubt, involves the injection of carbon dioxide gas under the skin as a way of contouring the face and body. Its proponents claim that the injection of gas will increase and improve the body's blood circulation, which in turn can reverse cellulite and some signs of aging. But coalition member Robert Weiss has said the contrary to what its proponents may advertise. The method has not been clinically tested or approved by the FDA as a cosmetic procedure. And among other risks, he said, having these injections made around the eye area can lead to blindness if gas bubbles enter blood vessels. We spoke to Dr. Mark Jewell, who chaired the coalition group.
Periodically, we do issue advisories and information to consumers. Our most recent one was about carboxytherapy and also mesotherapy, two areas of interest, yet at the same time with the potential for problems associated with these types of therapies. With regards to carboxytherapy, this is something that has been talked about primarily on the web and in chat rooms, things of this nature in terms of injection of carbon dioxide gas into the subcutaneous tissue to affect cellulite. We found that there's not very much written in the peer-reviewed literature that demonstrates safety and efficacy, and felt compelled to make a statement about this. We felt compelled to issue consumer advisory with regards to mesotherapy for several reasons. One is that we just don't have great information in the peer-reviewed medical literature that demonstrates the safety and effectiveness of these drugs. The second thing is that, for the most part, these drugs are compounded as opposed to being produced according to good manufacturing practices by pharmaceutical companies. That is, every time a patient comes in for an injection lipolysis or mesotherapy session, the drugs literally have to be compounded, which adds a lot of variability to the mixtures that are being produced. And without any sort of standardized mixture protocol or process, we feel that the risk for consumers is just too great.
The coalition wants to keep consumers aware of the practical and legal status of cosmetic injectables, plus any updates related to these treatments. More information is available at www.injectablesafety.org. Next in the news, Saudi Arabia is an area of the world known more for its culture of religious faith than for its embrace of something like cosmetic surgery. But a new report from the Associated Press shows that cosmetic surgery is indeed on the rise there, especially among women. They're most often requesting liposuction, breast augmentations, and nose jobs, and men are asking for more nose jobs and hair implants. In fact, the Saudi capital city of Riyadh alone now includes some 35 plastic surgery centers. But given that the religious culture of Saudi Arabia is still firmly in place, the new surgical trend has sparked some theological thought among its surgeons. The Islamic stance on appearance is that what we need to look like is what God created and should thus be left as it is. Based on this, Saudi plastic surgeons met with Islamic clergymen 3 years ago for a summit that determined which cosmetic surgeries are religiously correct. The meeting resulted in a few guidelines that are practiced today. The verdict was that undergoing facial surgery to fix damage brought about by an accident or a sickness is generally acceptable, while surgeries such as a nose job or breast implants are not. Any surgical procedure that is seen as vain or intended to make a patient resemble a celebrity is frowned upon. In spite of this, the AP reports such operations still commonly take place. One Saudi doctor noted that the demand for cosmetic surgery in Saudi Arabia is simply mirroring the trend throughout the rest of the world. The difference, he told the Associated Press, is that patients in the Middle East are more willing to undergo procedures that make their faces look increasingly unnatural, a trend likely spurred on by media coverage of entertainers who have undergone similar procedures. Coming up next, a report about an innovative surgery that could keep professional fighters from bleeding profusely in the ring. But first, a quick break. We'll be right back.
Hi, I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel. Last year, more than 350,000 women decided to get breast augmentation.
It helped me understand what my body would be like after the surgery.
And speaking of hard facts, let's talk about your olfactory organ.
So a prospective patient, when they're looking to have surgery, must always understand that every single surgical procedure has its import, and they must be concerned with the quality that's being delivered to them.